Hello everyone, I am Dr. Ramya, consultant obstetrician and gynecologist and laparoscopic surgeon working at Nano Hospitals, Hulimau. So the fourth important scan is the growth scan. Now as the name suggests again, the growth scan is done to assess the growth of the baby. After we have finished the NT scan and the anomaly scan and we are sure that the baby is growing healthily, further growth of the baby, mostly the weight of the baby, weight gain and other things happen after the 7th month. So the growth scan is done around 28 weeks. Now the frequency of growth scans, it depends upon patient to patient. Suppose there is any high risk factor, we may do a growth scan frequently like every 4 weeks once or sometimes every once in 3 weeks. If it's a low risk pregnancy, then maybe around 28 to 30 weeks we do one growth scan. After that maybe around 32 to 34 weeks we do another growth scan, and if required a term scan also can be done around 37 to 38 weeks. Now what are the important things we see in a growth scan? Firstly, we see whether the baby is growing adequately according to the gestational age, whether there is any lag in the growth, that is whether the baby is small due to any factors like less blood supply or anything, whether there is any lag in the growth we see. Second important thing is the fluid level around the baby. Now baby is in a sac called amniotic sac and that is filled with a fluid called amniotic fluid. This is an important one because it is through this fluid, amniotic fluid, the baby receives all the nourishment. And it is very important that the amniotic fluid levels are adequate. Any increase or decrease in the amniotic fluid will significantly impact the growth of the baby. So the second thing we see in growth scan is the amniotic fluid levels. Third one is the position of the baby, whether the position of the baby, that is the head is in the lower position or whether the limbs are in the lower position. So why this is important? Because the mode of delivery depends upon the position of the baby. Normally the head should be in the low down position to have a successful vaginal delivery. The next, like I said, the placental abnormalities, if any, can be diagnosed in the growth scan also. Suppose it was a low lying placenta, then whether it has gone up or whether the placenta is still in the lower position, which we term it as placenta previa. This is also important because if the placenta is in a very low position, then again it would be difficult to try a normal delivery. And certain emergency complications that could happen in pregnancy and it brings about changes in the placenta like abruption, those also can be diagnosed in the scan. Next important thing is the weight of the baby. Now when we see whether the baby is growing adequately, we also calculate the weight of the baby, whether it is ideal according to the gestational age, whether the weight is less or baby is overweight. Then accordingly we will be able to assess whether there are any risk factors the mother is having, like any hypertension, diabetes and other things. If at all specifically they have, then we also see whether there are any changes in the ultrasound in terms of baby's growth. So these are the points that we note in a growth scan, and doing how many growth scans needed depends upon the patient profile. So we can do 2 growth scans in an interval of 4 to 6 weeks, or sometimes it may be more frequent when mother has any medical complications like hypertension or diabetes. So that's the importance of growth scans. So these are the important scans that are needed to be done in pregnancy, because the ultrasound is the only way we come to know how the baby is growing. So I would like to say, go for regular checkups, do the ultrasounds as recommended by the doctor at the appropriate gestational age. Only then we will be able to help you out. Only then we will be able to make out if the baby is healthy or not. So all of you have a happy and a safe pregnancy and delivery. Thank you.